when you transform somebody from a medical standpoint, you're almost like embedded in the DNA for that human being for the rest of your life, whether you like it or not. And that includes everybody who's along for the ride of the care journey.
Sure.
And the whole idea is, what foot are you going to put forward when you're tied to that human being for the rest of their life, whether you like it or not? And I think the idea is that everybody needs to truly put their best foot forward when it comes to the transformation of these human beings.
All right, welcome back, beautiful people. This is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
And today's guest is going to be, it's near and dear to our heart. We've known him well for, probably a decade. The idea today, we'll talk about diving into the world of luxury integrative healthcare with Evan Pinchuk, co-founder and group CEO of Immortelle Healthcare Group. Evan's pioneered a unique blend of 5-star post-surgical care, functional medicine, and life optimization services in Beverly Hills, serving elite clients from celebrities to world leaders. We'll cover his journey, the innovative mission of Immortelle, and how they're redefining health and recovery. Evan, thanks for joining us.
Thank you for joining us today. We're going to ask you about all the celebrities that have stayed. All the world leaders, how much pain medicine they need, and how big of a pain it is.
We're intimately involved in some of these things. First of all, I think that the aftercare space is kind of a nebulous space most people are not aware of, and this is really, it's more than just going somewhere to be taken care of after surgery. We'll kind of dive into this. But first, I kind of wanted to go into your background. What initially sparked your interest in healthcare? Was it family? What events occurred that kind of brought you around to this side of the fence?
Well, it's funny that you should. Well, first of all, thank you for having me. I appreciate it. I will not be disclosing who we take care of, but we'll be disclosing the wonderful things that we do when we take care of them. So the interesting thing was my background was actually in film and television. And I was on the path to potentially run a film studio. That's what I was studied to do, and that's what I was doing professionally. And then a family member came to me and said, "Hey, do you want to join a private equity group?" I said, "Okay, tell me what this private equity group does." And they said, "Healthcare." I said, "Oh, that sounds exciting."
Sure.
Whoa!
Wow.
That sounds like
Yeah.
So the healthcare group was found. The private equity group was founded by some really talented alumnus of a company called Pacific Care, which was the largest HMO west of the Mississippi.
Right.
And they ended up selling it to United Health for over $9 billion. They ended up running multiple divisions of United Health and then left and formed a private equity fund. And they asked me to join them. And that's where I learned about helping to manage the lives of the masses when it comes to insurance and hospital systems and medical equipment and all this really exciting stuff. And yeah, that's where a family member asked me to join them. And that's where I learned, that's where I received my graduate degree in healthcare.
That is so different than what you do now. It's so interesting when you said that. You said you learned how to take care of the masses. This is completely the opposite.
Well, it's interesting because I think you have a blend of that with what you were, we've had some offline discussions on potential healthcare for functional medicine and things like that. But with what you're doing now at, Immortelle, Four Seasons Los Angeles, which is arguably, the best aftercare center. It's definitely my favorite.
No argument about it. 100% the best aftercare.
How was the transition between private equity in that particular fund and then looking at an aftercare center for plastic surgery patients or orthopedic patients or whatever it may be?
So when you look at the healthcare system in the United States, right, everybody has had to engage with it, and the reality is that the healthcare system in the United States is too large to care.
Right. Right.
And the fundamental thing that really drives everything when it comes to engaging with someone, whether it comes to a surgery or when it comes to your primary care physician, is time. Time costs money. And unfortunately, if there is not an investment in that time, it's very hard for someone to spend the quality time that's necessary to move the needle when it comes to any type of medical intervention, whether it's a laser of your brow to giving you Ozempic. It comes down to intelligent investment in time and actually being able to understand this human being that you're about to change for the rest of their lives.
Right.
So what was interesting was we said, okay, when it comes to taking care of someone, what does somebody really want? First of all, they want a setting that's elegant, right? So when we walk into your offices, it's stunning. I mean, it really makes a statement that like, okay, I've arrived at a location that is extraordinary, and now I want to know more. Now it comes down to precision. Like, how precise is this team or the medical practitioner or the post-surgical setting that's going to take care of me, right? Are they really good? Are they organized in their execution? What is their track record in terms of their academically? And it actually goes, it's like from beginning to the person who greets you as part of the experience, all the way down to sitting with like you guys in the office. What is that experience like in terms of how are you going to precisely deliver medical care?
Right.
Then transparency. When you think about it, there's so much hype around medical practitioners, and especially around surgeons, that the question is, are you truly getting the real deal?
Right.
And I think that's the thing that really separates. I mean, there are a lot of great surgeons that are precise. There are a lot of really elegant offices. Now becomes the question of, what is the transparent relationship between you and that surgeon that's going to change your life? Because you are going to be tied, you two are going to be tied together. And you guys have seen this with your patients. Mm-hmm. Right. I mean, we've seen patients of yours that have had multiple surgeries in their transformation, in their journey around how they want to evolve. And it's the transparency that I've seen, for example, between you guys and your patients that really sets the tone for a lifelong relationship with your practitioner. So I think that formula of elegance, precision, and transparency is like the secret to success. And I know that's what we try to achieve, and that's what I've seen, obviously, with your practice.
You're making me blush.
Yeah, look, I mean, it is
Pay me later.
interesting. I think you're right about hype, because social media has definitely changed the scope and landscape of aesthetic surgery and medicine in general. I mean, it's almost whoever takes the most photos and the most videos wins. And you kind of get to see behind the curtains on actual post-operative care, things that are happening. It's more than just looking at technique, but I would imagine it's extremely interesting from your perspective to see 10 different surgeons' patients come in and try to evaluate the things that you talked about, right? I mean, and I'm definitely not saying that you have to do that, but at some point, it's like us. When someone asks us, when you go out to a dinner party, do you look at someone and say, oh, I wish I would fix this, this, and this? You don't generally do that, but sometimes as a byproduct, you sometimes do that. But I'm imagining on your end, you are witnessing the culmination of all the things that you talked about with a patient that's lying there in bed. And you come to your own realization, opinion, whatever it may be, on who is carrying out the care that they're promising.
So when you think about it, there's sort of two parts to that conversation. The first question is, who was this person before they had a surgery?
Right.
Were they truly set up for success? So you can imagine everybody is wants to achieve these transformations. But the question is, from a self-care standpoint, are you setting yourself up for success? What are you eating? What are you drinking? How are you moving? Because the reality is you could come to Bedford and have a transformational surgery. Now you have this trajectory after, and how well you optimize yourself before you're on the operating table is going to directly dictate your transformation after the operating table.
So true.
Yeah. Yeah.
So true. And, it's interesting what John just said a minute ago. It's like, people can find us in a variety of different ways. For them to find aftercares is just really very surgeon dependent for the most part. And we've had the luxury of being in practice for 16 years in Beverly Hills, and that's something that's very common in our field, in the sense that they come in and they say, okay, I want to go to an aftercare. So the first thing they'll do is they'll ask me, or they'll ask our consultant, and there's a handful of aftercares in our area. And I have to tell you, and my first go-to is always Immortelle. And what you brought up is very true. And I think that you hit it on the head. There's precision, there's care, there's quality, there's attentiveness. When I send a patient of mine, or John sends a patient of his to an aftercare, I want there to be absolutely no glitches, because not only are they paying a lot of money, but they're expecting a lot. They're expecting, and people's expectations from where we are, where we're from, are sometimes really hard to actually deal with in a lot of ways. But I have to tell you, you and your staff do it better than anyone else. And I've said that from the first time I've ever sent someone there. And yes,
Yeah.
and I have the pleasure of taking care of a lot of celebrities, and they come in and out and nobody knows they're there, and they're taken care of, and just like a non-celebrity is, and everyone's taken care of the same. And I have to tell you, a lot of it has to do with the way you manage it. And you're on top of it. And I, again, this is something that I've never really, probably a couple times here and there have told you, but it's really you. You run the show. And
Yeah, I mean, you listen, it's the only 5-star accredited post-surgery care center in Los Angeles. I mean, so you have to look at how did you achieve that Forbes status so quickly? I mean, really.
So I think the thing that's really helpful is, first of all, one of the things that you pointed out was psychology, the psychology of who we're taking care of. A lot of that comes down to when these people make the decision to have a transformational surgery, it comes down to there's a tremendous amount of psychology involved, and where that really starts with is it starts with you guys. So somebody goes in, they're nervous about what's going to happen. Am I going to be in pain? Am I going to be able to walk? Am I going to be able to fit into my size 0 skirt? No, you won't.
Right.
You're going
setting expectations right off.
Exactly. Maybe exactly after having some type of treatments with you guys to achieve that will get you down to a size 0 again, but there's going to be some swelling. So the idea is, first of all, is communication between the people that are going to be part of this transformation. So one of the things that, again, working well with you guys is from a communication standpoint, even down like day 1 with your coordinator, it starts out, what is it, like 60 days before people are going to have this transformation. We already start to set people up for success psychologically around they're going to be safe. Because what's the point of having the surgery
Absolutely.
if you're not going to make it after? And there's risk out there, right? Come on, it's a medical surgery.
Absolutely.
So the idea is, when we work together as a team and we say, okay, 60 days, sometimes, half a year ahead of time, we're working proactively with these people to say, okay, we're going to set you up for success. This is what's going to happen. So we help to eliminate fear around the transformation. Okay.
Huge.
And eliminating that fear also eliminates inflammation of the body, which results in a far more rapid recovery because you're not walking around scared before and after. So we mitigate the fear. And now moving on to your second part, which is, okay, how do we get here? When it comes to, I think we started almost 6 years ago, and we've achieved the status of, from what I understand, the top post-surgical care facility of its type in the country when it comes to not only what we do medically to make sure that everybody's safe. So we have like an internal medicine footprint that has all these different capabilities, because the idea is we want people to be safe. If there's something that has to be medically managed, we don't, can we medically manage them instead of just punting them to an ER?
Right.
Because when you go to an ER,
Yep.
all bets
are
off.
Yeah.
Exactly. So that's why not only do we have our footprint at the Four Seasons, which is exceptional in terms of our ability to do ultrasound and EKG and a range of medical interventions, even down to our vibroacoustic sound pod, that if somebody's spinning out psychologically post anesthesia, they can go into the sound pod and it totally levels them out. It's really cool.
Amazing.
And then comes, okay, how do we treat these human beings? And we said, okay, if the standard for treating somebody in hospitality is Forbes 5-star training, why wouldn't we take all of our licensed professionals, from our business leaders, like our management, all the way down to our CNAs, so everybody executes from a same level of excellence when it comes to taking care of a human being at their most vulnerable time when they're coming out of surgery?
Yeah, it's a segue into looking at the mission. I mean, you emphasize patient care and luxury, as integrating the two together. So it's more than just having adequate care. It's feeling pretty comfortable. I mean, the idea is when you go into Immortelle, it's at the Four Seasons in Beverly Hills. It's, it's a warm, welcoming environment. And on top of it, in addition to, you're getting the care that you're paying for, right? And so I think it's a combination of those things that make it such a success.
Well, when you think about it, I'm not aware of a lot of people who like hanging out in hospital environments.
Right.
They tend to be kind of gross. You don't
People are sick.
Yeah, exactly. It's a place where you're sick.
Well, where was the place in Santa Monica? Remember, it was
Serenity.
Serenity, and it was very hospital based and great care, but all the patients would come out saying the same thing. I felt it kind of like I was stuck in a hospital, and I just underwent a tummy tuck.
Well, I think it actually was
It was
technically a
hospital.
hospital. It was
transformed,
a SNF.
and they're no
Right.
longer around.
Yeah.
Right. And so it just had that feel. There is something about, look, some patients aren't necessarily comfortable being taken care of at their home, even though that can be an option. And some people are definitely not comfortable being taken care of at a hospital because it's either, a traumatic experience in the past or a preconceived notion. But this is the perfect blend where it's like you feel the homey environment, but you have the appropriate care. To me, that's where I would want to recover, for sure.
So think about this. You've just had a traumatic medical event. Obviously, it's trauma, it's surgery, you're transforming your body. And now you transition to a 5-star hotel environment. Complete psychological disarmament of the patient.
Right.
It makes them say, okay, I am safe.
Right.
And it doesn't scream. Everything is, obviously there's the medical equipment in there, which is, we try to make it really, really, it's there, but it's not seen. So it's not intrusive. But the whole idea is it's almost like you're now in the comfort of a really incredibly laid out home environment. And now you deliver incredibly precise medical care along with incredibly precise 5-star customer experience around everything, down to the temperature of the room, down to the linens on the bed. So you can imagine you're now coming in, okay, and for the people that are and that can afford to come to us. And by the way, we make it financially accessible. We're able to do super bills, so somebody can come to us and they've actually had life-changing non-elective surgeries, and their insurance companies have covered 80% of the entire stay with us.
Wow. See, that's phenomenal.
So I can send my breast cancer patients to
Breast cancer, we've
Wow.
had patients successfully recoup from their PPO policies for breast cancer,
That's great.
for
I didn't know that.
orthopedic,
Amazing.
for multiple myeloma.
Wonderful.
We've had lipedema patients that have come to us for 4 consecutive surgeries. The insurance covered 80% of all 4.
That's awesome. That's great. That's
Will you
good to know.
cover 18 subspecialties or something like
Correct,
that?
18. Yeah. So on the so we cover the entire sphere of non-elective and elective surgeries on the Immortelle Med side, and then on the Immortelle Integrative Health side, we have a team made up of we are functional led in terms of functional medicine led, and then we have an entire team of PCPs and subspecialists in every single category that
Wow.
if there is a critical event that takes place on the post-care side, like for example, some of the wonderful doctors we work with, you guys work with Dr. Dandelion, who's the head of cardiology.
Yes.
We have a direct line to Dr. Dandelion. So if we had one of your patients that came in, right, that it
best.
was cardiac had a high cardiac risk.
Right.
One of the things that we're able to do is we're able to do 24-hour continuous cardiac monitoring for that. Let's say it's a patient that's 50 to 70 that has some cardiac risk and wants to go through a transformation. We can do continuous cardiac monitoring so we can see if there's any adverse event that takes place in real time. It's round the clock monitoring. They immediately alert Dr. Dandelion, and then he's able to intervene from a cardiac standpoint within seconds for a
that's
cardiac
incredible.
intervention to prevent the patient from ever having to be hospitalized.
Yeah, that's the interesting part for those physicians that are listening who think or assume that an aftercare center is not appropriate for certain individuals. This can tell you have a pretty high level of care. And it's different because you have the comfort of, look, we tried, when we had patients at the hospital, we tried getting them out as fast as we can. I love, the staff of the hospitals. I can't speak well enough about them. However, it also does house some really sick people with, really tough bugs to treat. And so the goal would be to try to get your patient out of there as fast as you could, right? And so this just offers a completely different environment. So I think, it's something that physicians should consider. And for those family members that are saying, look, I don't know that I feel comfortable, that maybe they do require some type of hospital, post-procedure hospital stay, that this is a great alternative.
Well, one of the things that the reality is that, listen, these surgeries, there's a return on investment, right? So people are expending 20 to 100,000 plus
Right.
for these experiences, and the question is, what's your life worth?
Right.
No, for sure.
What's the ROI in your life? So you had this transformation, and there are no shortcuts, especially when it comes to the first 24 hours after your surgery.
sure.
If something's going to go wrong, that's what's going to happen. So in working with surgeons like yourselves who make standard of care 24 hours mandatory, that you go someplace to help to protect not only the quality of your surgery, but also going back to your family alive, that's kind of important.
Right.
That's
You wanna be able
bring
to
up a
use the
good point,
transformation.
But when you say family, there's a lot of people that come to us that really don't have someone that's going to take care of them.
Right.
There's no real partner or caretaker in any way, and
Or think of the people who fly in from out of town.
or people that fly in from out of town. Or I just did a mommy makeover recently, and she's like, I don't want to go home to my kids. I mean, she came and stayed with you guys for a couple of days, and it's interesting to me because I'm like, of course, go have someone take care of you, really pamper you for the first couple of days. It'll just like you really hit it really hard, saying psychologically. Physically, a lot of these people would be fine, but psychologically, they're at a place where they need care. They want that. They want to be pampered. They want to be taken care of. And again, you do it great. And I said earlier, I said, you guys are the best. And the reason I say that is not because you're the best for me. Yes, do you guys protect doctors? You really do. Do I get called from you a billion times? No. You guys take care of the patients really well? Yes. But when I get the feedback from the patient is what matters.
Right.
And when they come back and say, that was an amazing experience, or for example, if there's someone else and they're like, why did you send me there? That makes me understand, hey, And again, it's like the 5-star Google review. Why does it matter? Because you really want to know what the experience was like for each individual. And I think that's what really matters the most.
Well, you know something interesting, going back to the point that you made at the beginning around wellness, right? So the idea, it's really interesting, is that we talked about, okay, how do we set somebody up for success after? And now how do we set someone up for success before, and how do we set someone up for success after? And the interesting thing is, from a wellness journey standpoint, I think it's really important that that as partners like yourselves with facilities like ourselves, that we look at, okay, what, as somebody goes through this before, and now somebody who's gone through this after, now how do we, in the first 24 to 48 hours, start to figure out from a GI standpoint, how do we move the needle to make these people feel normal again?
Right.
How do we help them? What kind of thing? What can we do from a neuro standpoint as a consequence of the anesthesia?
Right.
You know, how do we start to make them feel normal again? And I think one of the things that's really important in working with partners like yourselves and other doctors and surgeons around the country is, how do we work proactively from a wellness standpoint to help people feel normal again? And I think that's something that's really important for the entire world of surgery, whether you're doing a knee replacement or you're doing a mommy makeover.
Right.
You know, there's 50 million surgeries done in the United States annually between inpatient and outpatient. And it's the sort of the elephant in the room is, after the surgery is done, what do we do?
Right. Well, listen, let's go into that. You know, you specialize in post-procedure recovery. Walk us through a typical client experience on what they should expect. So let's say I've just finished a face and neck lift. We've been there for 6 to 8 hours. Go.
Okay. So I think the thing to point out at this point, I have an extraordinary partner at Immortelle Med. Her name is Jessica Jacobson.
Mm-hmm.
I can quite humbly say that she is, when it comes to pre and post surgical optimization, she's one of the most gifted practitioners in the United States around what she does. And so, and she's in fact doing her doctorate right now in this area of integrative health around pre and post surgical optimization. And after somebody comes to us from a procedure that is done, like for example at your OR, we now start to look at, okay, how do we, first of all, manage this patient psychologically? Because they're coming out of, they've had anesthesia, they're on pain medication, they're not their usual selves.
Right.
So how do we help to level them? One of the first things that we do is figure out, okay, how do we set them up for success psychologically with the people that are taking care of them, right? And that comes down to, like what we talked about, training around precise medical care and training around customer service, which Jessica really is. She is the mastermind of our ethos of care. Now come the interventions. Okay, how do you proactively take care of someone to mitigate something going wrong in the first place? Mm-hmm. So instead of waiting for the shoe to fall, you literally make sure the shoe is tied so it never falls off in the first place. So what type of interventions are you offering? So for example, some of the interventions that we offer are, one, are the food that you're eating is incredibly important because food is medicine. Right. So we actually the food that we developed was developed with the Cleveland Clinic to be low salt, low sugar, low caffeine, because we know that food is going to spike events adversely if you don't eat the right thing. So making sure the food is correct, making sure the temperature in the room is correct, making sure that the person is ambulating, right? People don't want to get out of bed, right? Breakfast in bed is amazing for vacation, really crappy for recovery.
Yeah.
Right.
Yeah. So the idea is, it's like, okay, you're going to eat this food. Now it's incredibly important to ambulate, right? Now there's other things that we do around, for example, photobiomodulation therapy or laser therapy, which is targeted reduction of the inflammation where the surgical sites are. But also, let's face it, when you have a surgery, you're going to shift your body, right? You're not going to, you got to keep shifting because you have these, you have the discomfort from the pain, etc. Now your back is affected, your neck is affected, your head's affected. Your life is affected.
Right, right. Just from head to toe.
Everything comes out.
Right.
But now you're able to drive down the pain and the inflammation in those areas that are either directly as a consequence of the surgery or a side effect of having to move your body around due to a mommy makeover or a facelift or a knee replacement. And then we go again, we talk about food, right? Now, when someone leaves, let's assume they've only hung out with us for 48 hours. Now, how do you set them up for success? So one of the things that we do, which is really unique, is we actually do a before, for our integrative health patients, before they actually will come to you guys, because we refer patients to you. Hopefully you like them.
Yeah. Thank you.
That's not it.
Yeah.
Let's think, you guys are really excellent at what you do, and people are consistently happy with the results. People feel safe in your care, and they come back multiple times because it's almost like they feel like your family.
Thank you.
Which sometimes you like better than your own family.
That's the problem.
Nothing my family. I love my family. They're wonderful, but I've heard stories. But the thing is, so for example, optimizing your gut health. There's a direct connection, and you know this, you're a DO, right? There's a direct connection between gut health and brain health.
Right.
So if you are really, really inflamed from a gut health standpoint, you can imagine, is it going to be easy to do the surgery in the first place? Probably not. And two, your recovery trajectory is going to be harder.
Right.
The next thing is genetics testing. Okay. There are genetics tests that genetic testing that you can do where you can actually see what pain medications can these patients actually be administered.
Pharmacodynamics. This is
if they're high metabolized or low metabolized,
Absolutely.
right through it, or it's going to take them. Yeah,
so
great.
if you can imagine, before somebody comes, right, when we're partnering together on a case, you have the ability to see, okay, I can intelligently medicate someone.
Very
Intelligent medication, which ends up resulting in pain management and a lower dependency of addiction.
Right.
When it comes to medications. I mean, that's, again, something that's incredibly important for setting someone up for success. And then there's also other genetics testing you can do, like 3x4 genetics, where you look at how they methylate from a genetic standpoint. But the whole idea is, how do we set someone up for success? Then immediately after the surgery, what are the interventions that you can do to cut care trajectory from a recovery standpoint down by 50%.
And this is something they do. They come see you before they even have the surgery.
That is correct.
Okay.
Yeah.
So that's something that is really great because no one else really does that.
No one does it
at all. So that's fantastic. And I do think that, and it's something that we've changed a little bit in our protocols too, giving vitamin drips in surgery and having people take certain supplements before, or having people start peptides before that are going to be anti-inflammatory. So I think it's great because we have these tools finally. Mm-hmm. We actually have these amazing ways to test things. Might as well use them, right? Especially after we're doing this major transformative surgery. So I think you're hitting it right on the head.
To help accelerate wound healing, reduction in swelling, and I think a lot of these things you were talking about earlier, what can we do from a neurological standpoint to make them more normal? Because people do complain afterwards of brain fog and depression, and there's all kinds of things. It's almost like a buyer's remorse. After you start feeling the discomfort, you say, what have I done? And it's nice knowing that that your hand's being held through the process, saying you made the right decision. We just got to bring you one step further, and that's
makes it a lot easier for us to deal with.
Well, it does. I mean, look, we've had recovery centers, and this is not the sole gauge of a recovery center. But we've had recovery centers where you hammer texted or called 50 times during that night, and it shows you the level of confidence of the person who's taking care of you. And then you find out, oh, well, they're not really true nurses, or they're not, they don't have much experience or something to that effect. And, it makes a big difference when you've got someone that says, look, just want to let you know, here's the blood pressure. You've written this, we've given the medicine. It has solved the issue. But it's like, I love receiving those messages, because it's, you've actually written an order that was followed to the T. You can tell the confidence level. It's just that it's a different ballgame.
Well, I think the thing that's interesting about our practice, that's similar to your practice, is you really sort of want to examine what is the relationship you have with these human beings.
Right.
Okay. So, for example, there are people that come to you just for wellness.
Right.
Right?
Absolutely.
They don't even come for an injection of Botox or filler or a Morpheus procedure.
Sure.
They're coming to you for plasmapheresis.
Yes.
And I think the thing that's interesting about the ethos of what you guys do and what we do is, how do you as a partner live alongside those that you take care of? Do you live in a way where you organically complement how they're living, or are you just a transaction?
Right.
Right.
It's a great point.
Cut and dump.
Right.
There are surgeons out there that we don't take care of their patients, where they cut and dump a patient.
Right.
And that is
They may never even see their patients after
that is
surgery.
correct.
Yeah.
Whereas
we hear about it. I still don't understand how you maintain a level of business, because it has to get back to,
we actually take pride in that, in the sense
Yeah.
that you want to see your patients. You've operated on someone. Number one, you want to make sure everything's healing okay, but you want to hold their hands. You know what I mean? You want to kind of be there for them. It's the whole point of doing what we do. I could have done radiology or pathology and never seen a patient.
You can still do it if you like to.
Yeah.
Radiologists
There's still-
right up there. It's just like when I heard about healthcare, I was like, oh my God,
Yeah,
radiology.
Ugh, here we go.
And the other thing is that we didn't talk about, and I know John brought this up, we just kind of keep interrupting you, but the flow of how this works, in the sense that when we have, Evan's group come in and take care of the patient, they come to our office with a nurse, pick them up on a stretcher, put them in a car, transport them to the Four Seasons, which is one of my favorite hotels, just happens to be down the street from my house, which is really convenient. And then there are two options. They can either bring them back to the office and have dressing changes and things like that at the office if we think it's necessary, or we can go there. And it's all done in a very first class, very kind of easy method for the patient, which is what's important. You want it all to be done in a very luxurious first class method. The other things that we don't talk about is, and I've had patients that have had their family members stay there and they've catered to them. And I mean, I remember we had someone there recently and that's the other thing. It's not just patient based. You guys are so giving to everyone that's out there, make people feel so comfortable with being there, which I think is great. Other aftercares I've gone, they're like, no, this person can't stay in the room. This person can't do this. And I think you understand hospitality in general. That happened right in the beginning, or is that something that's evolved?
Started from the beginning.
That's what I thought.
So when the origin of what we wanted to do in blending hospitality and medicine came actually from a really unusual place, a place called the French Laundry. Have you guys ever been to the French Laundry?
Yes.
I've been to ad hoc.
Okay.
I haven't ever gotten into French laundry.
Okay,
I
fantastic.
did go
Okay.
Once. I went.
Yeah, you were there.
with some friends. And-
How was
and
your experience?
The
when you went there?
experience is, again, it is. You can understand. It's more than just a meal. It is from the moment you walk into the door to the moment you leave. It truly is an elevated experience, and I can understand applying that now to other aspects of different businesses. It would be phenomenal.
Were you there with Gavin Newsom?
I was not there.
I have to do that.
Poor Gavin. Sorry.
Yeah.
Was
sorry
it
about that.
2028 or 2026 when you're due to run?
Yeah.
But we're I think it's important for us to do a shout out to Thomas Keller, who is the most highly decorated Michelin star chef in the United States. The standard for which he delivers either at Ad Hoc or Per Se in New York or Bouchon or at the French Laundry, which is like the mothership of what he does. It's really interesting when you think about it. Yes, the meal costs north of $300. Okay.
It's even that bad, actually.
It's quite reasonable.
Yeah.
I mean, compared to like In-N-Out, it's a pretty good deal.
You ever go to you ever go to Meadowood?
I'm sorry?
The other one?
I have not been to Meadowood. No,
That's insane.
really.
I mean, just the cost.
Really?
Forget about everything else.
I'm starting to sweat just thinking about it.
Yeah.
The pieces are about this big.
You're making me nervous. Where's my Xanax? When you look at it, what he's done year after year. So every single night, he has two seatings. Okay, I think there's like a 5 o'clock seating and like an 8 o'clock seating.
Right.
And it's 10 different courses that are delivered with elegance, precision. And transparency.
Right.
Every single to every single table.
Right.
2 seatings per night. And he does this day after day after day after day. He's obviously doing something right. Now let's turn to a procedure, or staying with us, for something that costs north of $3,000 per night, right? If I'm going to say to a consumer it's going to cost $3,000 to stay with me, and Thomas Keller is charging $300 to $400, and he's delivering an exceptional experience, well, for that much more, I had better set the bar really high and exceed it.
Well, I think you've done it.
Oh, wow. Thank
That's
you.
a great part.
No, you have.
I appreciate that.
Where do you see the future of Immortelle going? I know that we've had some offline discussions, and obviously this is one facility here in Los Angeles. Where do you see the future of Immortelle?
So there are two things that are happening. One, we are growing in Los Angeles. So we're going to be doubling our ability to take care of patients in Los Angeles due to demand. And we are also looking to expand in Miami.
Nice.
And New York City.
Very nice.
In our partnership with the Four Seasons. So we're very fortunate to work with an incredible brand that really goes the extra mile when it comes to just being a 5-star hotel transaction.
Hospitality.
Agreed.
Four Seasons is an incredible partner, and thank you. It's just been a match made in heaven when it comes to taking care of patients.
People that own that hotel on Doheny are awesome as well.
Yes, the Cohen family, they're
Cohens
exceptional.
are the best.
They have been supportive from day one because they understand Alita, who's actually on the board of Cedar Sinai.
They really are such good people, though.
They really understood, like, okay, when somebody comes out of Cedars, a fantastic hospital, you've now gone through this traumatic event, are we just going to send them home? There was a better solution. It was that transition that made you feel safe, made you feel comfortable, so you felt empowered to go home, versus being just dropped on your loved ones. So it's grown to be extraordinary. But the thing that we're really excited about at Immortelle is that we're partnered with this health insurance company, which I think I've told you guys about, called Stratos. And what Stratos is doing is they're bringing wellness and prevention to the entire employee population of the United States.
Love that. Love it.
So
Finally.
think about this, okay? There are blood tests out there that cost hundreds of dollars that you have to pay out of pocket for, right? And let's take a look at, like, so for example, there's this one company that we're dealing with, really, they have like 500 employees. And when it comes to wellness and prevention, nothing exists. It's just your major medical policy. So there's no multi-biomarker test that any of these employers are getting access to when it comes to a baseline for wellness.
Right.
It doesn't exist.
Right.
So we ask ourselves, okay, the population, unfortunately, we have obesity, we have hypertension, we've got diabetes. Great formula for successful surgeries, right?
Yeah, right.
Not so good, right? Your recover
Absolutely.
trajectory, whether
Absolutely.
again you're doing orthopedic or you're doing elective, your recovery is going to be harder. So one of the things that we're doing is we're one of the practices that we've been fortunate to be selected, where we gave them guidance on, okay, and again, shout out to Jessica Jacobson for all of her guidance. Couldn't do it without you. We advised them and said, okay, how can we give America access to a multi-biomarker test so they can discover what their truth is beyond what major
Right.
medical just wants to tell you.
Right.
Right? Now, after you give all these employees access to this testing information, they have a care plan which explains, okay, this is what you're now going to do to transform your life. Okay? Now comes the medical management medical management component. From a telehealth standpoint, from a mental health standpoint, we all know, again, another major problem in the United States is mental health.
Right.
It's a
Absolutely.
huge problem.
Big problem.
Every single one of these employees that's able to qualify is able to get access to a licensed telehealth, a licensed mental health professional, telehealth, within appointment within 72 hours.
That's awesome. That's awesome.
Okay.
I mean, it just makes sense. I mean, we've talked about this before on previous podcasts. So the sick care system is now it's hopefully going to be a thing of the past. And now just the prevention alone, even for all the healthcare companies, they're realizing it. It's going to save them so much money on the back end just by giving people awareness, pushing them into more of a wellness sort of routine as opposed to just treating a symptom. So I think that's phenomenal.
Yeah, no, it's incredibly exciting between the tests that we do up front, between a monthly artificial intelligence scan that you're able to do on demand that will tell you what your A1C is. It'll tell you what your BPM is. It'll tell you what your stress level is. And when you're able to discover something that's wrong, we're able to channel you to a telehealth professional or to a mental health professional or to a health coach at zero net cost to the employee
That's
Wow,
incredible.
and the employer.
That's phenomenal.
That's incredible.
So
that's
it is the mass democratization and access of wellness and prevention for the employees that power this country.
That's a game changer.
Yeah.
Because again, you're giving something to people that wouldn't be able to get it themselves. So that's great.
And think about it, what it's going to do for you guys. Imagine if you have a new baseline when it comes to all of your
Oh, it'd be
patients.
amazing.
How would that
Well, it helps
transform?
stratify who should be operated on and who hasn't. Because traditional medicine doesn't always pick up what we need, right? And so, but you're right.
Again, you're using these tools that we have, but actually applying them for people. Whereas before, it's great. I mean, the wealthy can get it, but not everyone. So that's wonderful.
That is 100% correct. It's access. It's radical access to the population
Wonderful.
for wellness optimization.
We pitched this to one of the biggest healthcare companies in the country, and we got shut down, 5 years ago?
Yeah.
Because the board didn't think made sense economically. So the fact that you made it work is fantastic. Because we couldn't.
So we obviously have the luxury of having seen and spent time in your facility. For the viewer or listener that is interested, let's say they're undergoing a procedure or they're thinking about undergoing a procedure, they're nervous and they have no one to take care of them afterwards. Where would they go to find what's the easiest way for them to explore, find the best information on Immortelle?
Sure. So we have two different websites that describe what we do. One of is immortellemed.com. That's IMMORTELLE med.com. And by the way, the Immortelle is named after the flower from Southern Europe that never dies.
Yes.
It's
Love it.
like so when the whole idea is that when you're involved in taking care of somebody, every time you work with them or take care of them, there's almost like this rebirth that they go through.
That's great.
So the idea is that you have this incredibly elegant, beautiful flower that is the name that inspired our company.
That's great.
And so you would go to immortellemed.com, and then for integrative health, you go to imhealth.life. That's imhealth.life.
Amazing.
And that's where you can learn about what we do. And we always try to find and try to go above and beyond when it comes to spending the time to communicate with these patients. Have you guys ever heard of something called care karma?
No.
Okay. So the idea is when you transform somebody from a medical standpoint, you're almost like embedded in the DNA for that human being for the rest of your life, whether you like it or not. And that includes everybody who's along for the ride of the care journey.
Sure.
So it includes you as surgeons, it includes your surgical techs, it includes your coordinator, the people at the front, down to everybody on our side who is engaging with that patient, a CNA, an LVN, an RN, an NP, a doctor. We're all tied to this person's transformation karmically. And the whole idea is, and whether you like it or not, you're tied to them for the rest of your life. What foot are you going to put forward when you're tied to that human being for the rest of their life, whether you like it or not? And I think the idea is that everybody needs to truly put their best foot forward when it comes to the transformation of these human beings.
Agreed.
Love that.
Agreed.
Listen, we're so thankful that you came and spent time with us. I know that you're definitely busy and you have empires to manage, but we're very thankful. And for those individuals, again, that are considering surgery and may have some fears about what they're going to do post-operatively, I highly encourage you to explore immortellemed.com, and you can ask your provider. I mean, the idea is you have the option, and so it's something we endorse. Again, no financial ties here, but this is our opinions because we see all of the aftercare centers, and just going off of 16 years experience, 32 between the two of us, that we just feel that they do it the right way.
Absolutely.
Well, I think the thing in closing is that when you think about reputation, right? How many years of medical school training did you guys have? Just curious.
Four plus.
Between undergrad, med school, and training, 15.
15. Okay, 15 years. Okay. And how long have you guys been practicing for?
16.
I'm asking the questions now. I'm how you.
I love this. I love this.
This is good.
All right, we're trying. Okay. So when you think about it, practicing together, and God bless you guys still practice together after 15 years.
Yeah.
Your wives must be jealous.
Yeah.
My wife calls her my work wife. So
it's true. God, seriously, I can see that. He's a good-looking guy.
Look what I have.
Seriously, my God.
I got the better end of
Literally, you guys are every morning. You guys are so excited to go to work with each other.
I'm like, oh, what's he wearing?
Sorry, but when you think about it, reputation, right? You take what you do so seriously, not only as human beings, but also as licensed professionals. So the question becomes, whether you do filler or whether you do plasmapheresis or whether you do an elective transformation, okay? Whoever you partner with in that medical management capacity is directly tied to your reputation.
Right, direct reflection.
So ask yourself, okay, would I operate in an unlicensed OR? Not going to happen.
Right.
Would I send to an unlicensed surgical post-surgical care facility after? How does that make sense?
Right.
It's like sort of illogical. So the idea is, and I appreciate that both of you have the same commitment, is that we're committed to doing things ethically and legally.
Right.
And that's really important because that's directly tied to your reputation, there are no shortcuts when it comes to taking care of somebody medically, and I appreciate that the two of you adhere to the same standard that we do.
Thank you.
It's good to have you,
we
man.
definitely can.
Definitely.
Yeah, listen. Thank you so much. Once again, guys, keep those questions coming. Ultimately, this is how we come up with these topics. And I think, one of the questions we were seeing over and over is, where do you recommend, or why do you recommend an aftercare? And for all of the aforementioned reasons. So once again, this is Forever Young. I'm Dr. John Layke.
I'm Dr. Payman Danielpour. You can listen to us wherever you listen to your podcasts. Check us out on your social media feeds, YouTube, Instagram, TikTok. Evan, thanks again.
Thank you, guys.
Thank you.